Rutherford Issues with Brian Barrett on FM 101.9 and AM 1450 Murfreesboro, FM 100.5 Smyrna. Listen and watch at WGNSradio.com.
And Rutherford Issues is powered by Middle Tennessee Electric. Thanks to Sharing Change, MTE members make a difference just by rounding up their monthly bills to support our local nonprofits. You can see how it works at sharingchange.org. Well, this morning we are going to focus on Interfaith Dental, and with that, we bring in Miss Michelle. How are you? Michelle Russell, how are you doing?
Doing good.
Make sure there we go.
Yeah.
Okay, so how long have you been at Interfaith now?
Yikes. Almost 10 years.
Is it really 10 years?
10 years this month.
Okay.
Yeah.
Loving every minute of it, I guess.
Every minute. Still there after 10 years, so
Yeah.
that says something, right?
Yeah. So before that, we ran in similar circles, I guess.
We did.
And so you really have, I guess, I will say easy job in the fact that it's pretty easy to promote, huh?
It is. It's easy when you've got people in the community that you can call on to help you out when you've got stuff to do. So that's why I always bring a friend.
There will be a lot of people that will enjoy our next guest because they can, in their cars or wherever they're listening, can talk back to him where, before when they would see him, they couldn't really say anything but, or, Dr. Roy Thompson, how are you, sir?
Oh, I'm doing fabulous. And just to clear it up, they talked back to me in the office, too.
Oh, did they? Well, I didn't know when they had stuff in their mouth if they could really talk back that well. But
I didn't ask a lot of open-ended questions, let's just say that.
Yeah. That was always the frustrating thing. Sometimes you go and they want to have this long conversation. It's like, well, you've got your hand in my mouth, so, I can't really say a lot. But how long have you worked with Interfaith Dental?
I have, the entire time here in Murfreesboro since 2012, I guess. I helped them in Nashville on their board for probably, I would say, 5 to 7 years before that. So probably now coming in on 15, 20 years.
Long before me.
That's crazy.
Yeah, it's been a good run. I've enjoyed every aspect of it.
Yeah. You actually started with Interfaith here in Murfreesboro, Michelle, I guess, pretty close after they had Interfaith in Murfreesboro. It wasn't too far after, right?
They had only been, the doors had only been open for about a year when I came on board. Yeah, so I've seen it all.
Yeah, well, a lot of growth, a lot of growth in that. I always like to, I'm talking about Interfaith because I've talked to you probably dozens of times now about different things, but there are always people who are listening in that find these interviews, whether they're listening on their radio or watching on YouTube or wherever it might be, and they find these interviews and they want to know, well, what is Interfaith? What is Interfaith Dental? I've never heard of it. Or maybe they moved here and they're just trying to find out more about the community. So what is it, I guess, your elevator speech about Interfaith Dental?
Well, so that has evolved over time, but Interfaith Dental started in the basement of a church in Nashville a little over 30 years ago. And like you just said, we, our footprint here in Murfreesboro, we've had our doors open for the past 12 years. So we are a nonprofit dental clinic, and we serve patients that are low income, that are dentally uninsured, and are really just trying to make ends meet, and they've put their dental health on the back burner.
So Rutherford County, but I guess part of the reason to be in Rutherford County, also in Davidson County, is to serve as much of Middle Tennessee as you can? Right.
So technically we serve a 10-county radius. So any county that touches either Rutherford County or Davidson County are folks that we can help, with the caveat of we say yes way more than we say no. So if somebody is coming a little bit further afield, for us in Murfreesboro, we have folks that are a little bit farther out that really don't have any access to any other kind of dental care. So we do make exceptions always.
And that's really evolved because, when we were in Nashville with the main clinic there, at some point we were looking at how do we serve other people, and the biggest group of people outside of Nashville were coming to Interfaith in Nashville from Rutherford County, and that's why we ended up putting the clinic here. So when we first started out, the focus was Rutherford County, and then we were like, okay, we can't turn away a child that's in need, so we're like, okay, if it's a child and they're outside of Rutherford County, we take care of them if they're in emergency condition. And then it sort of evolves because there's so much need. We always say we could have 2 or 3 interfaith clinics here in Rutherford County and still not take care of the people in need.
Yeah,
there's tons of need out there.
You mentioned those emergent situations. What does something like that look like?
Typically pain, but we see pain, sometimes not pain, some kind of infection with swelling that can, and any person, adult or child, can really evolve into something life-threatening at times. There are people that die from dental abscesses. It's unusual, but it can happen. And as Michelle said, when you're worried about paying the rent or paying your electricity bill or water, keeping the lights on, you're going to choose that, and you're going to stay in pain. And we see that happen routinely with the patients that tell the stories. Each year we have a fundraiser called Story Behind the Smiles, and there'll be somebody that will come. The patients, these are not professional speakers, but they get up on stage in front of 200 or 300 people, which takes a lot of courage, and tell their story. And some of those stories are, it's tough for those individuals because they've been in real vulnerable situations, and they kind of lay their life out on the line and tell this story, and there are tears in the eyes of people in that room every year hearing these stories.
When you mention that pain, I've had people who have said, I've heard stories from various folks who've had this type of situation, that it's the most excruciating pain, an abscess or something like that, that they felt, and they've had surgeries and, heart bypass and all this kind of stuff. And that says something about that pain that you were talking about, yeah. I guess. Volunteer work, I guess, Michelle, takes up a lot of how things get done with Interfaith.
Yes, it really does. I mean, we kind of tout ourselves as being a volunteer-driven organization, and I think that really is evident when you look around and you see people that have private practices right here in Murfreesboro, and they take their day off or time away from their schedule where they could be taking care of their own patients to come in and take care of our patients. It's kind of, twofold in that it's a great way for a local dentist to give back to the community in 4-hour spurts rather than, go, far afield for a week at a time. And also it helps us in that they come in and they take up right where the last dentist has left off in that treatment plan for that patient. Mm-hmm. So we're able to see, obviously, the more volunteers we have, the more patients we're able to serve. And
so the person just to your left is one of those volunteers?
Yes.
Well,
yes,
and we all serve in different roles. When I retired 3 years ago, I really made the decision, okay, I kept my license for about a year, but I'd seen my daughter to clean her teeth 6 months after I retired, and I was like, how do you lean the chair back anymore? And I realized then, I'm like, you don't need to be doing, if you're worried about cleaning somebody's teeth, you don't need to be doing other kind of dentistry. So I retired my license, but my involvement with Interfaith over the years, really behind the scenes, sort of brainstorming the future, obviously fundraising, just things like this. When Michelle or Rhonda, our executive director, needs help, they holler at me. And being retired now does give me more flexibility to help out behind the scenes.
You have some business partners. I know you do a lot of work with Ascension St. Thomas Rutherford. Any of those folks you want to mention and bring up here?
Yeah, well, so one of the things that the goal in our emergency program is to keep people out of the emergency department at the hospital. So if we can see them and we can take care of them, then they're likely not going to end up in the emergency room. then on the flip side of that, we partner with Ascension St. Thomas in several of their clinics to do the dental clearance for those people that are starting some sort of treatment. So we partner with Tennessee Oncology for folks that are getting ready to start chemo or radiation, and they have to have clearance. They have to have a healthy mouth in order to start that. And then most recently, Ascension Heart. It's the Heart Valve Center of Ascension St. Thomas. It's the very first time they've had the capability to do some heart valve work here at our local Ascension St. Thomas rather than folks going into Nashville. So those guys also need some dental clearance. So it's it's kind of a give and take. They know the importance of the work that we're doing, and we do our best to take care of those people as quickly as possible as well.
And recovery court.
So
how cool is this?
Yeah. So what has it been? 2 years? We have been the recipient of some of the opioid abatement funding, and what that has enabled us to do is to partner with several recovery agencies as well as the recovery court. So the recovery court has a couple of different spokes to it, and those people that are either just coming out of the prison system or finding another path to not being incarcerated, they can come to us and we can help them get work ready, make sure that they're healthy enough to have a job, to get a job, to interview, to be forward facing in front of a customer if that's kind of the job that they need. It's been really cool, and Dr. Thompson's been with us on that journey from the get-go.
Yeah. Speaking of our guest from Interfaith Dental, Michelle Russell, Dr. Roy Thompson, part of, I mean, we've just scratched the surface on the work of Interfaith Dental, but Dr. Thompson kind of touched on this a second ago. One of the ways that you receive funding to continue the work here in Rutherford County is through the event Story Behind the Smiles.
Yep.
It's coming up.
It's that time of year again. That's always when I see you, Brian.
Right.
And that's really an interesting event. We ask people to host a table, and people, well, how much is that going to cost me? Say nothing. It doesn't cost to host a table. It doesn't cost to attend the event. As a table captain or host, we ask that you invite 10 different people, so maybe 4 other couples besides yourself. And you come to the event, hear the stories, and decide, hey, is this something that touches your heart and fits your financial budget? And you donate. Last year we raised $160,000 on that event, which was fabulous. And that Michelle can tell you how many patients that will serve. But that's the things that keep us going. And so we have a heavy attendance of medical and dental professionals at that, but also people just from the community that if you're in the community and you're at any different place, you can see somebody that smiles, that's missing a tooth or has a black tooth, and it is really hard. We try not to judge people by their smile, but it happens, and those individuals, they're the ones we want to serve, and we want them to have a smile that they're proud of. That, when they smile, they don't feel like people are judging them. And this is an event, just one way that we can do that and raise funds to take care of people.
Well, you've figured out a formula on how to get people to open up their pocketbook, it sounds like, because at this event, it's actually the stories that are behind the smiles. I mean, you actually have clients come in and tell their story, and what better message than right from people who've been directly affected. So you've got a great formula here.
Right. Yeah. And the cool thing is about it is each year we've been able to raise just a little bit more money, but that is a direct reflection on the need in the community. So every dollar that we raise there at that event, we're going to be able to take one more patient off the wait list and get them in the chair and get them the care that they need. So I think it's not just a fundraiser, it's really kind of a game changer. I didn't practice that, by the way.
But you know what what we may want to do is on our list of target individuals that we invite. I see someone at this table that we might want to invite too.
It's been several years, but I was at one of those probably. I don't know. Time goes by much differently than it used to, but it's been 5-6 years ago, somewhere in there. Well, it may have been a few years after you started a decade ago. So who knows?
So if I can tell you, November 12th, so that's what you can put on your calendar. November 12th, we are again at the Fountains at Gateway. They've got a great room up there. They are super kind and accommodating to us. We've got
Is it an evening event?
It is an evening event. It's on a Thursday night. Thursday's kind of a dentist's Friday, so Thursday night at 5:30. We've got a couple of great co-chairs this year. Dr. Kim Pitts and her friend Lynn are going to co-host with Lori, who is a former hygienist who co-chaired our event last year too. She's a real go-getter. Those folks are going to bring everybody together, and they've got some really fun ideas for this year to include, we are going to have a patrons party this year, and at the home of Dr. George and Lynn, they're going to be inviting our table captains and our sponsors to get a sneak peek at their new house they just moved into, so that should be a cool thing.
And you mentioned Lynn. She just recently joined our board, our advisory board. Her and Dr. Eric Greenfield and Rachel Fleury. So we have 3 new board members. And that's a board that we try to pick people in the individual in the community that have the heart for this kind of service, that have circles of influence that can continue to bring people knowledge of interfaith, and bring individuals that may find a way to serve as health care professionals or as donors. So we're glad those 3 people have joined our board recently.
So where do we find out more about the event, Interfaith Dental? I guess you've got some information on your website, Facebook, that kind of thing?
We do, yep. So you can always go to interfaithdental.com, and it's INTER, Interfaith. Some people get that wrong, but you just keep on till a dentist's picture pops up. You'll know you're in the right spot. All that information about our event, how to attend. You can always email me. I'm easy to find. I'm Michelle Russell at interfaithdental.com, and then my phone number is all over on our website as well. But
okay.
Yeah.
Well, I'll put all that on the our website too, on the podcast section, and
Thank you.
It's always good to catch up, and maybe you'll have to come back and give us another preview of the event here in a few months.
Absolutely, we would love to. We've got 2 great speakers lined up. Maybe we'll bring one of those speakers with us next time we come.
And maybe anybody else you can pull off the golf course.
I know. Right.
It's good to have you both here today.
Thank you so much.
Thank you, Brian.
Our friends from Interfaith Dental, Michelle Russell, Dr. Roy Thompson joining today. And that's going to do it for the show. Hope you have a wonderful day, everybody. We'll see you back here next time.